Hello, this is Miss Straube. I am teaching CNA lecture chapters 58, 59, and 60. So this will be the very last test, test 20, and it will be tomorrow, Tuesday, March 28th. So also, before I get started on this lecture real quick, I want to remind you and tell you that you do need to be practicing Quizlet as much as you can, but also I posted to the CNA portion of Google Classroom tonight a spot to go on the Headmaster website and to do practice questions directly from them. There are about 10 or so to do, so please do those. Those made me feel a lot more comfortable today because the questions really gave you an idea of how they're going to word them on the state exam and so forth. We will test as soon as possible. I will be submitting your paperwork as soon as possible as well. I say I'm submitting it. I'm actually just going to be completing it, and then you will I'll upload it, but then you will have to put it on your specific TMU profile, and we'll go from there together. Okay, so let's get started on Chapter 58, Emergency Care. First aid is emergency care given to an ill or injured person before medical help arrives. Of course, the goal of emergency care is to prevent death and injuries from becoming any worse. In an emergency, the Emergency Medical Services or EMS system is activated. We do that by calling 911 or calling the local fire or police department or call the phone operator, which you probably don't know that much about anymore. We use basic life support or BLS for adults. So the American Heart Association or BLS procedures support circulation and breathing. The American Heart Association's basic life support course teaches the adult the chain of survival. So these actions are taken for heart attack, sudden cardiac arrest, respiratory arrest, stroke, choking, and other life-threatening problems. The chain of survival actions are done as soon as possible, and the chain of survival actions for the adult include recognizing the cardiac arrest and activating the EMS system at once or immediately, early CPR, early defibrillation, early advanced care. So advanced care would be the hospital, EMS services, doctors, nurses, and so forth. And then an organized post-cardiac arrest care. So cardiac arrest is the same thing as an MI, which is a heart attack as well, or the heart stopping. So sudden cardiac arrest is really defined, though, as when the heart stops suddenly and without warning at all. There are three major signs of sudden cardiac arrest. There is no response, no breathing or no normal breathing. Agonal gasps are not normal breathing. So those agonal breaths are going to be those really, really gasping for life breaths. Those are not normal breathing. No pulse, of course. The person's or patient's skin is usually cool, pale, and gray, and the person is not coughing or moving at all. Not responding to you, remember. Respiratory arrest, which is different, is when the breathing stops, but the heart action continues to go. If breathing is not restored, cardiac arrest will happen. Rescue breaths are given when there is no pulse, when there is a pulse, but no breathing or only gasping. To give rescue breaths, one should open the airway, give one breath every 5 to 6 seconds for adults, give one breath every 3 to 5 seconds for an infant or children. You should give a breath over 1 second, and the chest should rise with each breath that's given. You should check the pulse every 2 minutes, and if there is no pulse, always begin CPR. If the pulse is lower than 60 in an infant or child, start CPR as well. When the heart and breathing stop, blood and oxygen are not supplied to the body. So CPR must be started once a person is in sudden cardiac arrest. CPR involves 4 different parts: chest compressions, airway, breathing, and defibrillation. CPR procedure requires speed, skill, and efficiency, though, as you're doing it. The chest compressions, what they actually do is going to be they force blood through the circulatory system Before starting compressions, use the carotid artery on the side near your neck to find the pulse. For effective chest compressions, the person must be supine on a hard, flat surface. Remember supine, remember your positions. Supine is flat on your back. The hand position is also very important for effective chest compressions. And then moving on to the airway. The respiratory passages or airway must be open to restore breathing. The head, tilt, chin, lift method then needs to be used to open the airway. Please pay attention to the pictures on, it says slide 7 of 10 or so on actually it's slide 11, sorry. Continuing on for BLS for breathing, if the person does not get oxygen, permanent heart, brain, or other organ damage can occur. A rescuer inflates the person's lung. Mouth-to-mouth breathing is one way to give breaths. A barrier device can be used, but not very common that it's available. Mouth-to-nose breathing is going to be used when you cannot breathe through the person's mouth. And mouth-to-stoma breathing is used for people who breathe through stomas in their neck. Before giving mouth-to-mouth or mouth-to-nose breathing, always check to see if the person has a stoma. Defibrillation. This is like talking about the AED or some way of shocking the heart back into rhythm. Ventricular fibrillation causes sudden cardiac arrest. A defibrillator is used to deliver a shock to the heart. The shock stops the VFib and allows the return of the regular heart rhythm. Defibrillation as soon as possible on the onset of VFib, which is a serious heart problem, increases the person's chance of survival. Moving on here, CPR is done only for patients under cardiac arrest, remember. It is done if the person does not respond, is not breathing or gasping, and has no pulse. The recovery position is going to be used when the person is breathing and has a pulse but is not responding. The recovery position is defined as log rolling the person into the recovery position, keep the head and neck spine straight, and do not use this position if the person might already have neck injuries that you know about. For children and infant, basic life support isn't much different. Sudden infant death syndrome, otherwise known as SIDS, is the sudden unexplained death of an infant younger than 1 year old. It is the leading cause of death in children between 1 month and 1 year of age. It usually occurs during sleep. Cardiac arrest caused by heart disease is rare in children. More common causes involve respiratory diseases and injuries that lead to respiratory arrest or circulatory failure. Moving on to slide 20 of 46 on chapter 58, choking. Foreign bodies can obstruct the airway. This is called choking or foreign body airway obstruction. This is when the air cannot pass through the airways and into the lungs. The body then doesn't get enough oxygen, and it can lead to cardiac arrest. Severe airway obstruction is defined as where the air does not move in and out of the lungs. If not removed, the person will die. Abdominal thrusts are used to relieve this obstruction. Poisoning. A poison is any substance harmful to the body when ingested, inhaled, injected, or absorbed through the skin. Some common signs and symptoms of poisoning are going to be burns or redness around the mouth and lips, a chemical odor to the breath, burns, stains, or odors on the person, on his or her clothing, and around the patient. Empty drug bottles, or spilled containers. Vomiting, dyspnea, which means very painful breathing, drowsiness, and confusion. Also follow these emergency procedures or measures for poisoning. For poison in the eyes, rinse the eyes with running water. For poison on the skin, remove any clothing in contact with the poison and rinse the skin with running water. For inhaled poison, leave the area, get the person to fresh air immediately. For swallowed poison, do not have the person try to vomit or give them anything to cause vomiting. Do not give the person anything to eat or drink unless told to do so by the Poison Control Center. Excuse me, you guys. We're going to move on now to hemorrhage. Hemorrhage is going to be the excessive loss of blood in a short time. If bleeding is not stopped, the patient will die. You cannot see, internal hemorrhage. This is where the bleeding is inside the body tissue and body cavities. Signs and symptoms of internal bleeding or hemorrhage are going to include pain, shock, vomiting blood, coughing up blood, and loss of consciousness. External bleeding is defined, if not hidden by clothing, where it is usually seen. Bleeding from an artery that occurs in spurts, or there's a steady flow of blood coming from a vein. Fainting. Fainting is a sudden loss of consciousness from an inadequate blood supply to the brain. Common causes include hunger, fatigue, fear, and pain. Dizziness, perspiration, which is sweating, and blackness before the eyes are warning signals. The patient usually looks pale, has a weak pulse, and has shallow respirations if conscious. Shock. Shock is when it results when tissues and organs do not get enough blood. The causes of shock include blood loss, heart attack, burns, and severe infection. Signs and symptoms of shock include low or falling blood pressure, rapid or weak pulse, rapid respirations, cool, moist, and pale skin, thirst, restlessness, confusion, and loss of consciousness. Shock is possible in any person who is acutely ill or severely injured. Anaphylactic shock. Anaphylaxis is a life-threatening condition or sensitivity to an antigen, like an allergy. An antigen is something that the body reacts to. Say, for instance, a bee sting in someone that's allergic to bees. Anaphylaxis can happen within seconds, and it is usually, always, an emergency. The emergency medical system must be activated, and the person needs special drugs to reverse the allergic reaction. Keep the person lying down and their airway open and start CPR if cardiac arrest happens. Stroke. Stroke is also called a CVA or cerebral vascular accident. This occurs when the brain is suddenly deprived of its blood supply. It is usually only one part of the brain is affected. A stroke may be caused from a thrombus, which is a blood clot, or an embolus, or hemorrhage if a blood vessel in the brain ruptures. Signs of a stroke can vary in size and location and brain injury. You might remember like facial drooping, slurring the words, noticing that one side of the body is weak versus the other as well. Moving into seizures. Seizures are convulsions that are violent and sudden contractions or tremors of muscle groups. This is where their movements are uncontrolled. The person can lose consciousness, but seizures are caused by an abnormality in the brain. Seizures or convulsions are violent and sudden in muscle groups. They can be caused from a head injury, high fever, brain tumor, poisoning, nervous system disorders or infections, lack of blood flow to the brain, a seizure disorder, and then lastly, epilepsy. Epilepsy itself is a brain disorder in which clusters of nerve cells sometimes signal abnormally or not correctly. In epilepsies, seizures reoccur. The person has permanent brain injury or defect from it. Children and young adults are commonly affected with this. Epilepsy can develop at any time during a person's life. There is no cure at this time. There are drug therapies that work for some patients that decrease the amount of seizures, and doctors order these drugs to prevent them from happening. When controlled, epilepsy usually does not affect learning or activities of daily living. The major types of seizures are partial seizure and generalized tonic-clonic seizure, which is also called a grand mal seizure, which has two different phases. In the tonic phase, the person loses consciousness. In the clonic phase, the muscle groups contract and relax. If you are seeing a generalized absence or petit mal seizure, which usually lasts a few seconds, there's a loss of consciousness, twitching of the eyelids, and staring. So nothing like those muscle contractions that you normally think of with a seizure. There is no first aid necessary for a petit mal seizure. You cannot stop a seizure. You can protect the person from injury. So your number one goal with a patient with having a seizure is safety first for yourself and the patient at all times. Concussions. Concussions are head injuries that can be minor or serious and life-threatening. Concussions is the most common type of brain injury. A concussion usually happens from a bump or a blow to the head or a jolt to the head or body. The head or brain can move quickly back and forth. The symptoms can last for days, weeks, or longer. The symptoms affect your thinking, your physical function, your mood, and your sleep. Emergency care for concussions includes you need to watch for signals and the need for emergency care. So a headache that gets worse or does not go away, a stiff neck, weakness, numbness, or decreased coordination, nausea or vomiting more than once, slurred speech, very sleepy, drowsy, and cannot be awakened at all, one eye pupil being larger than the other, convulsions or seizures, increased confusion, restlessness, and agitation, unusual behavior, loss of consciousness, and so forth. You need to provide basic life support if the person is not responding or breathing. Place your hands on both sides of the head to keep it aligned with the spine and prevent movement. Apply firm pressure with a clean cloth to the bleeding area for a concussion if they have any bleeding. Do not remove any object from any wound if they have bleeding or some area fractured, but apply ice packs to swollen areas. Burns. Burns can severely disable a patient or people. Burns can cause death, but most burns occur in the home. Infants, children, and older patients are at risk for burns the most. There's a nasty picture there on slide 40. Okay. Superficial burns is going to be that first-degree burn. We've talked about burns several times in this class, especially if you were in my class last year. It involves the epidermis or that first layer of skin only. These are painful, but the burn is not severe. This is going to be most sunburn cases. A partial thickness burn or second-degree burn involves the epidermis and part of the dermis, or the second layer of the skin. These are very painful, and nerve endings end up being exposed. A full thickness burn is a third-degree burn. It involves the entire epidermis and the dermis layer. Fat, muscle, and bone may be injured or destroyed in these two, and nerve endings are definitely destroyed. The severity of the burn depends on the burn size and the depth, the body part involved, and the person's age as well. Burns to the face, eyes, ears, hands, and feet are more serious than burns to the arm or leg. Infants and young children and older patients are really at risk for this. To keep that. And they are the ones most at risk, high risk for death is what I wanted to tell you. Alright, you guys, there are a couple of first aid videos there on the end of chapter 58. If you would like to watch them, that's just fine. I'm going to move on to chapter 59 after I take a quick breath. I know this is long. Alright, chapter 59, end-of-life care. End-of-life care describes the support and care given during the time surrounding death. Death may be sudden or it may be expected. Some people gradually fail. End-of-life care may involve days, weeks, or even months. According to the National Institute of Aging, most people die in hospitals or nursing care centers. You must understand the dying process. Then you can approach the dying person with caring, kindness, and respect. I got to see some of you guys able to see some patients on hospice at clinicals and some that were very near death. I really appreciate how you guys acted very appropriately, curious, but very, very appropriate. Terminal illness itself. Terminal illness is defined as an illness or injury from which the person will not likely recover from. Many illnesses or diseases have no cure. The body cannot function after some of these injuries. Recovery is not expected, and the disease or injury ends of death. Hope and will to live strongly influence living and dying. Patients with terminal illnesses can choose what's called palliative care or hospice care. Palliative care focuses on the relief of symptoms. The illness is also treated. This is where care of the long-term illnesses that will eventually cause death. Settings for palliative care include hospitals, nursing centers, and the person's home. Hospice care. It mainly focuses on the physical, emotional, social, and spiritual needs of the dying patient and their family. Hospice care is not concerned with a cure or life-saving measures. Often the person has less than 6 months to live on hospice. Hospitals, nursing centers, and home care agencies offer hospice care, or hospice may be a separate agency completely. There are a lot of different attitudes and beliefs about death. Experiences, culture, religion, and age influence attitudes about death. Attitudes about death often change as a person grows older and with changing circumstances. Practices in death differ among cultures. In some cultures, dying people are cared for at home by their family. Some families prepare their body for burial on their own. Spiritual needs relate to human spirit and to the religion and religious beliefs. Attitudes about the death are closely related to the patient's religion. Some believe in an afterlife, while others do not. There are also religious beliefs about the body's form after death. Some believe the body keeps its physical form, while others believe only the spirit or soul is present in the afterlife. Reincarnation is the belief that the spirit or soul is reborn in another human body or another form of life. H. And attitudes about death. I am on slide 10 of 31. Adults fear pain and suffering, dying alone, the invasion of privacy, and loneliness and separation from loved ones. Adults worry about the care and support of those left behind. Adults often resent death because it affects plans, hopes, dreams, and ambitions. Sorry, you guys. There are 5 different stages of dying, according to Dr. Elizabeth Kubler-Ross. Those 5 stages are included: Stage 1, denial; Stage 2, anger; Stage 3, bargaining; Stage 4, depression; and lastly, Stage 5, acceptance. Dying patients do not always pass through the 5 stages. Some move even back and forth between them. Comfort needs of the dying patient. Comfort involves the physical, mental, emotional, and spiritual needs. Comfort goals are to prevent or relieve suffering to the extent possible. Please respect and follow the end of life wishes. Some people may want to see their spiritual leader. Some people may want to take a part in their religious practice. Provide privacy during prayer and spiritual moments. Be courteous to the spiritual leader. Their spiritual leader, that example would be like a priest or the preacher from their church or something like that. Handle religious objects with care and respect. Physical needs of death. Dying may take a few minutes, hours, days, or weeks. To the extent possible, independence needs to be allowed. As the person weakens, we need to meet their basic needs. Every effort is made to promote physical and psychological comfort during this time. The patient is allowed to die in peace and with dignity. Pain. Some dying patients do not have pain, while others have severe pain. Pain management during death is very, very important. Pain management and other things promote comfort, like good skin care, personal and oral hygiene, back massages, good alignments in the bed, frequent position changes, and supportive devices. Breathing problems can happen near the end of life. Shortness of breath and difficulty of breath, which is dyspnea, difficulty breathing, are common end-of-the-life problems. The semi-Fowler's position and oxygen are helpful. Noisy breathing, called the death rattle, is common as death nears. This is due to the mucus collecting in the airway. These may help. The sideline position, suctioning by the nurse, and drugs to reduce the amount of mucus. Vision, hearing, and speech near the end. Typically, the patient's vision blurs and gradually fails. Secretions may collect in the eye corners, as good eye care is going to be important during this time. Hearing is one of the last functions to lose. Always assume that the patient can hear. Speech becomes harder. It may be hard to understand the patient. Sometimes the person cannot speak. But remember the last thing. The patients lose the hearing last. I've talked to you guys before about talking to ICU patients that are not conscious. Just because you think that they cannot hear you does not mean that they can't. To treat them with the same dignity and respect, like explaining the procedure to them, even if they're not conscious, is important. Mouth, nose, and skin care. Oral hygiene promotes comfort in the patient. It is needed if mucus collects in the mouth and the person cannot swallow. Crusting and irritation of the nostrils can occur, and nasal secretions and the oxygen cannulas are common causes of this dryness as well. The circulation in the patient fails and the body temperature rises near death. So the patient gets hotter. They're not able to regulate their temperature, so they get too warm. The skin, though, is cool, pale, and mottled or blotchy. Perspiration increases, so they're sweating. And the skincare, bathing, and preventing pressure injuries are very necessary. Nutrition. Nausea, vomiting, and loss of appetite are common at the end of life. As death nears, loss of appetite is common. The person may choose not to eat or drink. Elimination. Urinary and fecal incontinence may occur. Constipation and urinary retention are very common in these patients. Enemas and catheters may be needed, but not always. The patient's room during comfort measures. Provide a comfortable and pleasant room for the patient and their family. Remove any unnecessary equipment. The patient and the family arrange the room as they wish. This helps them meet the love and belonging and esteem needs. The room should reflect the person's choices. Mental and emotional needs are very personal. Some patients are anxious and depressed. Some others have specific fears and concerns. Examples may include severe pain, when and how death is going to occur, what will happen to their loved ones, and dying alone. This is a very hard time for the family. Family members can usually stay as long as they wish. Respect their right to privacy. However, do not neglect them because the family is present. The family goes through stages like the dying patient. They need support, understanding, courtesy, and respect. A spiritual leader may be there to provide comfort. There are legal issues dealing with death and dying and approaching death as well. Consent is still needed for any treatment. When the person is able, they need to make their own decisions. Some people make their end-of-life wishes known early on. The Patient Self-Determination Act, or OBRA, give the patients the right to accept or refuse treatment, make advance directives, and an advance directive is a document stating a person's wishes about health care when that person cannot make their own decisions. A living will is a document about measures that support and maintain love when death is likely. A durable power of attorney for healthcare gives the power to make healthcare decisions to another person if they're not able. After consulting with the patient and the family, doctors often write a do not resuscitate or DNR order, or no code. for terminally ill patients. This means that the patient will not be resuscitated or coded. Signs of death. In the weeks before death, the following could occur or may occur. Restless and agitation, shortness of breath, depression, anxiety, drowsiness, confusion, constipation and incontinence, nausea, loss of appetite, hearing problems, swelling in the hands, feet, or other body areas, and pauses in breathing. As death nears, the following signs could occur fast or slowly. So movement and muscle tone and sensation are lost. Peristalsis, and gastrointestinal function slow down. The body temperature rises. Circulation fails. The respiratory system fails. And pain decreases as the person loses consciousness. The signs of death include no pulse, no respirations, and no blood pressure. The pupils are usually fixed and dilated at this point. A doctor determines that death has occurred. Care of the body after death. This is called postmortem care. A nurse gives postmortem care. You may be asked to assist with this. Postmortem care begins when the doctor pronounces the patient dead. Postmortem care is done to maintain a good appearance of the body. The right to privacy and the right to be treated with dignity and respect still apply after death. Within 2 to 4 hours after death, rigor mortis, which is the stiffness or rigidity of the skeletal muscles that occurs after death, happens. The body is positioned in normal alignment before rigor mortis sets in, which is going to be a supine position. When an autopsy is done, post-mortem care is not to be done. An autopsy is defined as the examination of the body after death. You have to follow agency procedures for the autopsies. There is a short video at the end of this chapter 59, just as there are in a lot with end-of-life care. We get to move on to something much happier in our last chapter of CNA, chapter 60, getting a job. Getting a job. So get yourself to the slides if you can. Successfully completing a nursing assistant training and competency evaluation program gives you the valuable credential for employment. Sources of jobs include newspaper ads, so where to look, local and state employment services, agencies you work at, people you know, your instructor, family, friends, the internet, your school or college job placement counselors, and your clinical experience site. Gosh, I'm having trouble talking. What do employers look for? They look for staff that are dependable, are well groomed, have needed job skills and training, and have values and attitudes that fit in with the agency. Employers need to know that you have the required job skills. You need to have the course completion, a high school, college, or transcript, or an official grade report card. A job application needs to be filled out, and this is your first chance to impress the employer. A job application is usually easier to complete if you have a file or of your education or work history. The file should contain a copy of your high school diploma or GED, a copy of any grades, reports, degrees, and completion, the nurse assistant registry information for each state which you are registered, copies of communications with your state agency, copies of court records for criminal convictions, a copy of your social security card, name, addresses, and phone numbers for references, name, addresses, and phone numbers of current and past employees, which include your job title, dates of employment, your supervisor's name, and your hourly salary. Proof of in-services that you attended and continuing education, that's also called CEUs. And then after you have an application, you may be called for a job interview. The job interview is when the employer asks the job applicant questions about his or her education and career. The interview may be at the time when you complete the job applications, and some agencies schedule these after reviewing applications. Some interviews are done by one person or a panel. A panel is going to be considered 2 or more people. When an interview is scheduled, write down the interviewer's name and the interviewer date and time. If you need directions to the agency, ask for them when the interview is scheduled. There are different types of interview. Boy, oh boy, do we know about this now. An in-person interview, so they're at the place, face-to-face. A phone interview, a video interview, and so forth. During the interview, you should politely greet the interviewer. Good eye contact is going to be important the entire time. Review the job description with the interviewer and ask any questions at this time. After the interview, you should write a thank you note or email. Include the date, the interviewer's formal name using Miss, Mrs., Mr., and so forth. A statement thanking the person for the interview, and comments about the interview, the agency, and your eagerness to hear about the job. Your signature using your first and last name. Accepting or declining a job offer. Accept a job that is best for you. When you accept a job, agree on a starting date, pay rate, and work hours. Ask where to report on your first day, and ask for such information in writing. You may want to decline a job offer. If so, thank the person for offering you a job. Drug testing. State laws vary about drug testing. Drug testing may be a part of the application process. The application may state one of the following: that it is a process for new staff, or that a job offer depends on passing a drug test. And then here, the last slide, of course, includes an example of a job interview. We are possibly going to be having a job interview day. That will be in everybody, the whole class, and so forth. It's been a great year with CNA, and I've learned a lot. I hope you have, and have a good day.